Good afternoon and welcome to today's press briefing. Again, thank you for those here from the media that are here, and thanks for all those across our state that are listening in. We'll have a number of speakers today to cover a number of topics, but let me just kick it off here with a little different approach today. I think as we said yesterday, of course it's Saturday, the COVID-19 pandemic is not taking the weekend off, neither are your leaders in the state of North Dakota. This weekend is also unusual for another reason. Probably in the first time since before the founding of our state, tomorrow, most of the in-person faith-based congregation organizations are not holding church services tomorrow. That's the majority of those. They're doing that's going to be unprecedented for many North Dakotans in their lifetime who might have been regularly attending their faith-based organization Sunday services. So this is a different thing, but I think we need to think back even prior to statehood. The first Americans that were here, American Indian tribes, had their whole culture based on spirituality. Our nation was based on faith-based founders, and our Constitution, unlike many other countries, supports freedom of religion, one of the things that brings us together. And as Americans, we know that our faith has brought us together during times of war, economic distress, and other crises. And as we know from past emergencies, North Dakotans don't lose faith during an emergency. If anything, their faith grows stronger. So I want to kick off today with gratitude, which of course gratitude is a core practice of many of the global faith practices, but to those organizations and to their leaders, thank you for making the courageous decision to not hold services tomorrow. That's part of being North Dakota smart. And I want to say to whether you attend church regularly or not, let's keep them in our hearts and minds and continue to support them, because many of those organizations, even if they're not meeting, are doing important volunteer work to help North Dakota and our citizens get through this crisis, whether that's working at food banks or supporting those that are in economic distress. We know that they play an important role and important fabric in our lives, in our communities, and in our state. So today we'd like to begin our briefing by inviting Chaplain Greg Carr here to open with a prayer today. Chaplain Carr comes from the Crisis Care Chaplaincy for Emergency Services. For those that may not be familiar with, this is an organization that was founded here in Bismarck in 1979, and they do incredible work supporting police, North Dakota Highway Patrol, first responders, ambulance personnel, and they've been doing that for decades. So please, we'll bring up to the podium to kick things off Chaplain Greg Carr from the Crisis Care Chaplaincy for Emergency Services. Chaplain.
Wherever you are in the state, please join me in prayer. Our precious Father and gracious Creator, you are a compassionate, loving, gracious, all-powerful God whose timing is always perfect. We come to you in a trying and testing time as we walk the tightrope of dealing with the COVID-19 virus. Nothing escapes your sight. Our needs are never overlooked. You, Father, are our rock, our fortress, and our hope. You use the good and the bad and the complex matters that we navigate daily to test and grow our faith. In 2 Chronicles 7:14, you urge your people to pray by saying, "If my people who are called by my name shall humble themselves and pray and seek my face and turn from their wicked ways, then I will hear from heaven and I will forgive their sin and will heal their land." Today, Father, our government pauses and we pray and we ask for your help. We pray against fear, knowing that you have not given us a spirit of fear, rather you have given us a spirit of power and love and of a sound mind. May our fears turn to faith and turn to courage as we focus on you. We pray for wisdom for our leaders and for our protection for our emergency personnel as they diligently do their jobs to protect lives and prevent the spread of the virus. And I pray that your blessing upon their families as well. Father, we pray that this virus will cease worldwide and that you will heal every person who is currently affected by it. May we continue to devote ourselves our families, our state, and our nation to you during this time. And when this time has passed and this virus is no longer a threat, may we remember to give you thanks. Father, help us to treat others the way we want to be treated. And God, as your word reminds us, our enemies will turn back when we call upon you for help. So, Father, again, we ask for your help during this time. Give us all peace, courage, strength, and wisdom. And most of all, Father, give us hope. May we continue to give you praise in all things. We pray this in the name of the King of Kings and the Lord of Lords. Amen.
Thank you, Chaplain. Appreciate that very much. And again, to those out there, again, ask everybody who's not in church this weekend, prayers still matter. And as the chaplain said, let's be praying for all those medical personnel and first responders and law enforcement that are out there on the front lines as we work through this emergency. Let's move on to case updates. But before we do that in North Dakota, let's take a look nationally and internationally, because that gives us a window into this global pandemic and how it is now reaching North Dakota. One of the things that we can look to, I think, when we look at Western democracies, in particular, because the form of political government that you have affects how quickly and how tightly you might be able to, lock down and stop the spread through government mandates. China had a bit of an advantage in that because of their form of government. But Italy becomes instructive then, and Italy now, which has less than 5% of the population. There's about 60 million people that live in Italy. There's 1.4 billion that live in China. Italy has now passed China in terms of number of deaths. And in the last 24 hours, they leapt up with another 793 people who've passed from the COVID-19 crisis. So this again, for folks that are thinking that the U.S. or portions of the U.S. are acting too quickly, this is a reminder because people say you can't predict the future, but we can look and observe how the pandemic is spreading in other locations around the world. And as I said yesterday, one of the reasons why we may be benefiting here in North Dakota is because of all the travel requirements first put on federally, restricting travel from China to the United States. And now with the lockdowns in the hotbed areas on the two coasts and conventions being canceled and less vacations, less travel, less contact between people, that is certainly going to have an effect on slowing things down. And for geographies like ours that we're fortunate enough not to have one of the early cases, we're benefiting from the actions that are be taken by our neighbors and by the country. And so with the U.S., however, we still have a lot of cases happening in the U.S., 15,219 confirmed cases of COVID-19. There have been 201 deaths in the United States. All 50 states, District of Columbia, Puerto Rico, Guam, and the U.S. Virgin Islands have now all reported cases of COVID-19. So it has spread across the entire country, including remote island geographies. Today, the North Dakota Department of Health confirmed 2 additional cases of the coronavirus disease, COVID-19, both in Burleigh County. One was a woman in her 20s from Burleigh County, and that has been identified related to travel. A male in his 30s from Burleigh County is attributed to community spread, meaning that there was through the contact tracing, not able to identify specific contact with someone who had traveled. What brings us to the totals, again, kudos to the great work being done by the private sector and by our state lab, but we're now up to 1,169 total tested. That's plus 231 up from the report that we gave yesterday. 1,141 of those happily are negative, which means we've got another 229 negatives from yesterday, 28 total positives plus 2 from yesterday, and we have 1 more hospitalization. So we now have 3 people that are hospitalized in the state related to COVID-19. So the good news is that unlike many other states, we're able to report that for 2 days in a row, we've got fewer positive cases than we did before. I would like to say that's be positive for today, but as I've cautioned at every one of these meetings, testing is a lagging indicator, and the fact that we've got very few positives is not an indicator that the spread is not more widely than we might think. We now have received tests from 48 of 53 counties, and so again, at least from a testing standpoint, we've nearly reached the whole state. Again, hopefully this means that the steps that we've done to encourage social distancing has helped slow the spread of COVID-19. But again, we want to make sure that everyone understands, regardless of your age, no one is immune. Of the 28 positive cases that we have, yes, 9 of those cases are people that are 60 and older, but 7 of those are under age 30, the remainder are under 60. So what that means is 2/3 of the cases in North Dakota are people under the age of 60. And if you are under the age of 60 or under the age of 30 and you have this may not be life-threatening to you unless you have an underlying chronic disease, but you do have the ability to infect lots of other folks, which again, we want to remind people again, the basics here: stay home if you're sick, even if it's minor. And a reminder that again, if you're well, but you've been in contact with someone who is been tested or who has been sick, even if you don't have symptoms, you still could be carrying the virus and you still could be infecting other people. So when we talk about stay home if you're sick, let's combine that with social distancing. Even if you don't have any symptoms, you should be practicing social distancing, because the actions you take could save the lives of others. And again, if you're even if you're just out shopping or for a walk, again, the recommendation is more than 6 feet away is what we're trying to get to help reduce the transmission that may be happening. And of course, regular washing your hands is also important. One of the studies that came out of Italy, when they quarantined an entire town of just over 3,000 people near Venice, they tested everybody in the town, and half of the people they tested had no symptoms but tested positive. And so again, in North Dakota, where we've been prioritizing testing, it's highly likely that we have people who have not been tested, who don't have symptoms but are carriers, which is, no matter how well you're feeling, we want to again reinforce that social distancing is for everybody, not just for people that are coughing and sneezing and aren't feeling well. Social distancing matters for everyone. And again, if you've got a family member who's being tested right now, then stay home until your tests arrive. And again, if that family member does test positive, we're asking the entire family, if you've been in close contact, that you would also go into the isolation for the next 14 days. Here at Team North Dakota, we're trying to practice what we preach on social distancing, and we respect the incredible effort that the private sector businesses have been doing across the state to allow workers to work from home. But now through the end of day yesterday, we're now set up roughly 7,100. Over 7,000 North Dakota team members are going to be working from home this weekend or on Monday. On testing, we continue to ramp up our testing, and there's been a lot of talk about testing, but I think it's important to think about testing in terms of per capita or tests per number of people. There's a lot of talk about New York doing more tests than anyone else. That's absolutely accurate. New York has tested 17 out of every 10,000 people. They've got a lot of people living in New York. North Dakota is right behind them. We've tested 15 out of every 10,000 people. So on a per capita basis, based on the information we had today, North Dakota is at the front of the pack in terms of the amount of testing per capita, and we're well ahead of our neighboring states to the west, south, and east in terms of testing. And again, thanks to South Dakota for helping us out with some swabs, as you heard yesterday. Again, we want to make sure that the whole country continues to move that up, the testing up. There's, as you've heard nationally and from press conference earlier today, testing capacity is ramping up and gaining, and there's more testing coming. But for right now, it's still important that we're prioritizing and testing those people that have prioritization. And if we need to cover that again, my Lynn Tufte can walk through that prioritization later today. On other news, Also talked to Senator John Hoeven this afternoon. I want to thank Senator Hoeven and Senator Kramer and Congressman Armstrong, who Lieutenant Governor Brent Sanford and I have been in contact with this afternoon as well. But those three are working hard to help pass legislation to help address the deregulation to allow us to effectively manage this medical crisis. And they're also working on some really significant economic legislation to help provide support for those businesses and individuals affected by this. And the other role that Senator Hoeven plays is that he's chairman of the Senate Indian Affairs Committee. Last night, again, as part of our regular rhythm, talking to businesses and leaders and health organizations around the state. We had another call last evening between the governor's office, Scott Davis, who leads Indian Affairs, the 5 tribal chair leaders with whom we share geography, and many of their council leaders. We were on from 5:30 to 7:30 last night, getting great input from all of them. Independently, because as sovereign nations, they're all taking a bunch of moves, but we want to thank them, the tribes and the tribal cheerleaders and their councils for taking the courageous decisions they're doing, and most of them are moving towards closures of their casinos this weekend, following other actions that they've taken prior. So we appreciate their collaboration. After the call last night, Scott Davis and I also and our staff got on the phone with Mike Andrews. He's the staff director and chief counsel for the U.S. Senate Committee on Indian Affairs. Again, advocating, as we did with Senator Hoeven. I know he's also championing this, but working to make sure that the tribes in our state and around the country are remembered in all the legislation that's happening. Next topic, we have one new executive order that we've signed today, and today, just before again this conference, signed executive order that's going to help us on another aspect of social distancing, because social distancing helps slow the spread of COVID-19. But what we're doing is we're expanding the list of those authorized to administer COVID-19 tests to include licensed pharmacists in our state. So that'd be another location that you could potentially get tested, and that's in collaboration with the North Dakota Department of Health. So a licensed pharmacist could do the swab and send it in. Gives more places for people to get tested, increase our overall testing, which again, if it improves our data and helps us make good decisions. Another thing, which is we're doing is through this executive order, is under current law, if you're a pharmacy and someone's prescription for their what would be considered an emergency medication, they're only allowed right now to refill that for 72 hours. Then they have to go back to their doctor and get another, written prescription. The emergency refills would be for things like chronic diseases that would include diabetes, so a prescription for insulin, blood pressure, cholesterol, these kinds of chronic those kinds of chronic things. We are allowing now through executive order that licensed pharmacists, and working with the Pharmacy Association and working with the Insurance Commissioner, John Gottfried, also worked on this executive order, but this executive order will allow pharmacists to do emergency refills for up to 30-day supply, where previously it was 72 hours. Excluded in this order are all class 2 licensed drugs, so that would include all of the opioids are excluded from that. So you're not able to get a 30-day supply for an opioid, but for emergency refills. One of the other things that also exists in regulations is that if someone is delivering these medications to a home, it's required proof of delivery. That generally means that somebody needs a signature before a mail-in or others could drop it off, and we're dropping that requirement of the proof of delivery requirement to reduce person-to-person contact when those medicines are being delivered. Okay, that's the executive order related to pharmacy and pharmacy testing and refills. Next topic. Been getting a lot of questions about driver's license and motor vehicle registration. As we announced yesterday, through yesterday's executive order, all driver's license and motor vehicle registrations that expired March 1 or later will still be recognized and honored throughout the duration of this emergency. We've added to that today that the TSA will also indicate that it will honor expired North Dakota driver's license, so people could board a plane if they had essential travel. We want to reaffirm, as we do true for all activities in state government, that even though we're moving people off site, we are open for business, and the North Dakota DOT is open for businesses, and we will have restricted access starting Monday, but the DOT is open. Many driver's license services can be provided online. Appointments and other in-service purposes will not be available for Class D driver's license renewals, real IDs, tests for driver permits or licenses. So those are not available, but one of the essential things we have to keep moving in our state is commercial driving, because commercial driving is essential to our state's economy, whether that's medical supplies, whether that's agricultural commodities to help feed the nation, or other essential goods that we're trying to resupply the supply chain here for food or supplies for people in North Dakota. So we did have a backlog on CLD driver's license, so we're going through some special work to do that. But renewals, permits, knowledge tests, road tests, and new licenses will be available and can be scheduled by appointment starting March 30 as NDDOT develops a process for scheduling, because we got a backlog, I think, of over 300 CDL licenses that we're trying to move through to make sure we don't have any restrictions there, but part of the work that they're doing on the process for how to schedule this, there will be requirements where both the testers and the drivers would be required to wear N95 masks, during that driving test portion. Motor vehicle licenses such as license plates and titling can be done by mailing in paperwork. Vehicle renewals can be done online or at self-service kiosks or by mail, and happily NDDOT is waiving the motor vehicle kiosk fees for renewing your vehicle until the emergency declaration is ended. And then maybe we can take a look at waiving it after that. I've never liked that one. Anyway, so for more information, dot.nd.gov is on those. Rest areas, we've been talking about those every day. We've got new schedule updates from DOT. Again, this involved repairing stuff from vandalism at the rest areas, and it also involves having more cleaning crews there to make sure that we're doing the right kind of sanitation and work when we're the environmental cleaning work there. But on Sunday, tomorrow on I-94, the Bismarck eastbound and westbound are going to be open. On Monday, Mapleton, Lynchburg, and New Salem, westbound and eastbound on I-94. And on Tuesday, the Elm River, which is between Fargo and Grand Forks, that rest stop northbound and southbound on I-29 will open. Again, more information on that on dot.nd.gov. Next topic we want to talk about is hospital preparedness. We've talked a number of times at these sessions about trying to make sure that when we do have a surge in cases, like now we've got 3 hospitalizations, we can handle that. If you see places again like Italy, where New York, California, Washington, so many cases so quickly as things spiked up, they were unable to provide all the services that they wanted to be able to provide. So then this is and again, we can save lives if we've got access to 3 things. 1 is hospital beds, 2 is equipment, including ventilators, and 3 is ventilators and personal protective equipment for the medical personnel, and then the 3rd is staffing. So those 3 streams we continue to work on through the Unified Task Force. But we are posting online. We've talked about flattening the curve a number of times. This is a infographic which is going to go up on the North Dakota Department of Health social media and on their webpage. We would ask people to refer to this if this is something you can use to help explain to your kids, explain to whoever you're talking to. But the pink line here that's the pandemic development without protective measures. The blue line that comes across is the healthcare delivery system capacity for dealing with COVID cases. And by all the efforts we're doing on social distancing to slow the spread, will stretch it out over time. The area under these 2 curves may be exactly the same, meaning the same number of people are going to get sick over a period of time. But in the bottom scenario, with appropriate health care, then you have lower mortality. Fewer people die because we're able to care for them, and we don't put anybody in the position that they got to in Italy, which is they had to decide which patients got a ventilator and which ones didn't. And literally then you're taking people who've dedicated their lives to the healthcare profession having to make life or death decisions. That's what we're trying to avoid. None of you would want to have to make that decision for any of your loved ones, or if you had two loved ones, pick which one. So what we're doing here is helping to flatten that curve. So again, that's available online. In our healthcare system in North Dakota is made up of private sector, including a lot of fantastic nonprofits with great capability. We've got two leaders here from two organizations that serve our state and the region. And they're here to talk a little bit together about how North Dakota can get through this working together. We've talked about whole of government, whole of community, and really when we talk about individual responsibility, we're actually talking about the whole of the state. Every citizen has a role to play. But today we've got executives from Sanford Health and CHI, St. Alexius, from here in Bismarck, from Bismarck, to talk to us about how they're prepared so far, what they've seen so far, and what they think might come. And so we're going to have those folks come up. And so let's bring to the podium Dr. Mike LeBeau, president of Sanford Bismarck, and Curt, Schley, president of CHI St. Alexius Health, and if both of you would like to share a few words. Before you get up here, I just want to say, I know that you've been collaborating with each other and with the state. We really deeply appreciate that collaboration. And for the citizens, what we're working on is we've asked these private sector leaders and our own planning team to come together to develop a statewide plan, because if each system plans individually, that may not optimize for the whole state. And these larger systems have stood up and they're ready to prepare and help, like again, our 36 critical access hospitals in our smaller communities. Even if they don't have a formal relationship, these folks are ready to try to do that. But we want to understand through our statewide planning process involving these great private sector organizations, where's the people, where's the equipment, where are the beds? Do we need more of any of those things to help us get through? Because the other thing, we want to lower the curve through social distancing. We want to raise that blue line by optimizing our capability. We want to raise that capacity, and that's what these guys are working on, is to make sure we've got the most possible care and the highest levels of care available. So let's bring up Mike and Curt.
All right. Thank you, Governor, Lieutenant Governor. As we've talked about this, you'll see. Yep. So I'm Mike LeBeau. I'm the president, CEO of Sanford Bismarck. And
I am Curt Schley. I'm the CEO of CHI St. Alexius Health in Bismarck.
So we decided we're going to tag team this portion and just kind of talk about just a few topics that are kind of on the top of our minds. First one is testing. And so there's been a lot of questions about testing, and we've actually had some good conversations about where we're at and where we think we're going. We want to continue to test symptomatic patients. As the governor said, we've done a very nice job in North Dakota getting out and testing folks. And so that means across the state. But as we get going, we got to make sure that we're stewards of our resources. So our messages have been very clear. I think that you'll hear the same message. We want to test you with risk factors. We want to test you with symptoms. We ask everybody to call ahead. I think one of the most important things in this is that we take these folks and that we isolate the testing. And so everybody has their unique way that we're doing testing as far as standing up clinics or doing drive-through testing, but we want to keep people separate. I think it's important that we go through a stepwise screening test. You got to have symptoms. I think the governor said a lot of folks are asymptomatic, but as of right now, testing supplies don't allow us to just randomly test folks. So right now, we as a group are saying, test with symptoms. Along with symptoms, risk factors. Risk factors are travel. It was obviously out of country travel, but as we have increasing cases, the CDC is changing guidelines. It's now endemic areas in the United States, and then exposures. The symptoms are very similar to all of our upper respiratory tract infections, fever being the key one, but then any cough, not feeling well, body aches, anything that you would think of with viral illnesses. I think one of the things that a good time to say is it's important that we work together. I really do want to give a shout out to the Department of Health and our state lab. If you look at where other states are at currently, we're lucky that we still have supplies, that we're still still testing, and that's because I think our state has done a very nice job of coming together and working to make sure that we're testing. So turn it over to you, Curt.
Okay, thank you, Mike. We are two different health systems, but right now we are unified in working together, and our commitment to our community and our patients has never been stronger. I'd just like to talk about preparedness, incident command structures, and let me just say that hospitals prepare for events like this. You heard Mike say the Department of Health, the North Dakota Department of Health, all of your hospitals in North Dakota are collaborating with the North Dakota Department of Health. We are following CDC guidelines. Hospitals are members of the North Dakota Hospital Association. We are in literally constant communications with regards to COVID-19, what's taking place nationally, what are the lessons learned nationally, how can we apply them here in North Dakota. CHI St. Alexius Health is part of a national health system. Sanford is also part of a large health system, and we are getting learnings from hospitals that are at the forefront of the curve. We are getting updates from what is occurring in the Seattle Pacific Northwest. We're bringing that to our hospitals here in North Dakota, if in the event we have the same level or the same infection levels as they have in the Pacific Northwest. We have established an incident command. I would say all of the hospitals in North Dakota have established an incident command. We have put all of our key resources into a room, and on a daily basis we assess supplies, labor, those things to make sure we can continue to care for our patients. We've also taken steps to limit the exposure in our hospitals of COVID-19. If you're coming into a hospital in Bismarck in North Dakota, you will notice that public access has changed, has been restricted. At St. Alexius, you'll be routed through the east entrance. You heard Mike talk about screening for COVID-19. When you come into the hospital, you'll be asked a series of questions to make sure that you are not infectious or do not have COVID-19. We've also taken the step of screening our associates and our medical staff members for their safety, but also for the safety of our patients. We've also done some other, smaller things, but very important things, and businesses in North Dakota could also look at doing this too. We've removed magazines, newspapers from our waiting rooms. Those have been eliminated. Our cafeteria at the hospital is still open to provide food, obviously for our patients, our visitors, and our staff, but we have removed salad bars. We've gone to prepackaged items, and our dietary staff are serving from behind the counters out of an abundance for safety for the folks eating that food. The governor has talked about, Mike has talked about, and I would just like to reiterate the importance of social distancing. A hospital needs to operate. We all need to be in rooms and meetings to collaborate and talk, but we are practicing social distancing. 6 feet. When 6 feet is not possible, at the very least, every other chair, and we're using the technologies that are available with teleconference and video conference so we can continue to communicate, but doing it in a very safe way. We are coordinating and collaborating not only with the North Dakota Department of Health, the CDC, but we're also working with Common Spirit, which is part of the parent organization that CHI St. Alexius is a part of. We have large numbers of hospitals on the West Coast and also in Nebraska, and the best practices that we're bringing are coming from those places in addition to the North Dakota Department of Health and the CDC. These protocols are changing, and I would say if you're coming into a hospital and you notice one thing on one day and it's different the next, that's because with COVID-19, we are learning more and more about the illness on a very rapid fashion. The phrase we like to use at the hospital is it's a very fluid situation, and our policies and approaches to it need to be very fluid as well. Next, we'd like to talk about capacity of our workforce, how we're staffed. Mike, do you want to take the lead on that, or do you want me to keep going?
Go ahead.
Okay. We continue to have adequate resources with regards to physicians, with regards to nurses, and other healthcare professionals to combat and as we prepare for COVID-19. If in the event we see occurrences of what have occurred in other parts of the country, there have been some very positive things that have happened in our state to help us prepare for that, and we are doing those things now. The governor earlier this week passed an executive order where healthcare workers, physicians, nurses, and other healthcare providers in other states that are licensed in good standing can come to work in North Dakota. So Sanford, CHI, we have plans, we are developing plans to do that right now. One of our approaches, being part of a large national system, is we have the ability to move resources, staffing, supplies, and equipment to where we have the greatest need. So while we collaborate here locally, myself and other members of the team at St. Alexius, and I'm sure members of Mike and his team are having the same conversations within the Sanford system, we're talking about, as a system, how are we set for resources of staffing and supplies, and in the event that they need to be distributed, where is the greatest need? And we have plans right now in place to make that happen. Mike?
I think the last thing that we kind of wanted to talk about this afternoon was supply chain. As you pick up news, you watch news on TV, you'll see that people are making difficult decisions across the world and across the state. As we talk about flattening the curve, why it's important to slow things down, it's exactly because of this. We actually have had lots of conversations discussing where we're at and how we're working together with the state. An example is ventilators. If you think about number of ventilators and you start making difficult decisions, if you're short a ventilator and somebody needs it, that's a tough place to be as far as making decisions for families, for healthcare workers. We feel that across the state, as long as we work together, that we have enough ventilators to supply at the modeling. As you start thinking about protection equipment, PPE, that everybody wears at line of sight also becomes important. You can read studies of people taking care of folks without gloves, without masks because they ran out. Also very important that we're stewards of these. We're working together very closely with the state on a disaster plan to make sure that we have hospital beds, ventilators, and test kits for everybody. But it's important that we do it. It's also very important that we work on the modeling. We're going to work together with the state. I think we're working with a model to give us some rough estimate of number of patients infected, number of hospitalizations, and number of people that need critical care. At this time, we feel very comfortable that we have the PPE equipment that we make it through this. It's a fluid situation, as everybody talks about. I think it's important that we plan, that we stay calm, and that we're ready. We feel that we're healthcare. This is what we do. I don't think as you go from hospital to hospital across the state that you're going to find panic. I think people feel comfortable that as we work together and we work with the state, that where we need to be. I have just a couple of things that I would like to just close with from my standpoint. One's accountability. We talk a lot about accountability in healthcare. As you come into your doctor's office, eating well, exercising. Social distancing should be an accountable thing that we all look at ourselves in the mirror with. It's easy to preach it, it's hard to live it. Americans aren't used to it, but it makes a difference. Accountability for social distancing is for our own health as well as others. We always say 60 and above, but there are many cases. In fact, I will tell you, we have 2 cases in North Dakota that are getting sick that are both under 40. And so it isn't just 60 and above and we're protecting them. There's plenty of cases across the world that it's pediatrics patients and 20-year-olds. And so we don't want to take this lightly. And I think the accountability is there. I think the accountability of our healthcare systems have to be in place. We have to hold the line of what we think is important. We have to be able to tell people, here's our testing guidelines, and we got to hold to them. We got to share our resources. We got to be able to steward those if we're going to get through this. Next thing is calling ahead. If you think you have symptoms, if you have exposure, please don't go to a clinic unannounced. Please call ahead. it allows all clinics to protect the staff that are front line. You got to tip your hat to healthcare workers at times like this. I'll tell you that there's a little bit of fear in some folks as they stand in front each and every day knowing they're going to be exposed. Everything that we can do to protect them is important, not only for their health, but for our workforce. My last plea is actually a special plea for blood donations. As we think about what we're doing and the responsibility of social distancing, there's some things that I think we have to make exceptions for, and one is blood donation. And so blood donations are down, and we do not want to run out of blood products at this time. And so as we think about how we're doing them, we may have to do them differently, but we want to make sure that we're ready and prepared when the time comes. So, thank you.
Mike, those were fantastic comments. Accountability, social distancing, calling ahead. Calling ahead is if you feel like you have symptoms, that you have COVID, that is very, very important. Call ahead to the clinic, the hospital that you're going to, so they can be prepared and they can receive you in a way that is urgent for you, but also gives the providers in that organization a chance to prepare and safely care for you. I would just add one other comment to what I said earlier about the governor's executive order about healthcare workers coming in from other states. And you heard Mike talk about modeling, and we have plans. The models have not come to fruition, which is great. But if they do, you will hear us talking about physicians, nurses, other workers coming from other states. But another opportunity we have is, please, those of you that are listening to this today, that are retired healthcare workers, physicians, nurses, please consider coming back during this time of need, should the need arise. And contact your hospitals that you were affiliated with, contact the North Dakota Hospital Association, but please be thinking about that. The need is not there today. We want to be prepared, and that will help us do that. The last thing that I would say, and just echo on to Mike's comments, is there are hospital workers across the state that every day put their lives on the line. They are committed to North Dakota. They are committed to their patients. This is a time of extreme focus. There are individuals at Sanford Bismarck, there are individuals at CHI St. Alexius that are in instant command on the floors, that are working hard, that are stressed, they're tired, but they're making plans in the event we need to implement them. We hope we don't, but the healthcare community, please, let me assure you that every hospital across the state is mobilized for this. We are preparing for this, and if we stick together, follow the guidelines we've talked about today, we will be strong and we will be successful. Those will be my comments.
Thank you, Curt. Thank you, Mike. And thank you to your organizations, and thanks to everybody across the state in the medical field that's working so collaboratively to do this. Next up, to sort of capstone this section, we want to bring up Major General Alan Dohrmann. General Dohrmann is the Adjutant General of North Dakota. He's served overseas on 2 deployments. He served with distinction. Was pleased to reappoint him last year to his second term as Adjutant General. He's been doing a fantastic job in that role, and as part of that role, he's also leads emergency services for the state. This has been compared to a war. I think that's appropriate in the sense that when you're fighting an enemy, one of the things you have to do to win that is you've got to be good at supply chain, you got to be good at logistics, and we're very lucky that in our North Dakota National Guard here we've got lots of engineers, lots of people that have worked both here and overseas on that supply chain business, and they're great at planning. They're great at planning for emergency services. We got a great emergency services team. So here's Major General Alan Dohrmann. He, along with Mylyn Tufte, are co-leading the Unified Command. He's going to talk a little bit about one of the work streams from the Unified Command, and that's the planning that's going on with our medical community. General Dohrmann.
Thank you, Governor. Social distancing comes easy for me. I'm an introvert with very few friends. So if you're wondering how to do that, just watch me walk around on a daily basis. But that is critically important. The governor has talked since the beginning of this event that we need a whole of community, whole of government approach to this. Emergencies are a team sport. And while it has been mentioned by our partners at Sanford and CHI, St. Alexius, we've had great communication between our hospitals and our Department of Health. Right now, I would say it's a pickup game, and it's time to really bring the team together and make sure we're all following the same lead by the governor and the cabinet and all of our state agencies. So the next step is to make sure that we are doing joint planning with our hospitals. We have 36 critical care hospitals across the state. CHI, St. Alexius, and Sanford have already agreed with us that we need to get liaisons between these hospitals and our State Emergency Operations Center so we understand what these plans are. Because part of my job as the facilitator of the state response is to have a clear picture so I can generate options for the governor and other leaders where our shortfalls are so we can, again, generate options to fill those shortfalls. There is some great work that's been going on within the state and with our community partners and our business partners. We need to understand their plans. They got to know our plans so that if that peak hits at the wrong time, that we have the resources to respond. And doesn't do us any good if we have a lot of beds and ventilators in Fargo, but the problem's in Williston. We got to stay ahead of that. And to do that, we've worked already on some modeling. We're refining that. We have very little data now, but we know that's important. Because for leaders to make informed decisions, you have to have some modeling out there. You have to have decision points because we cannot be late to need. And as you know, we keep getting latent data. That's the nature of the emergency we're in. So we have to do our best to see the future and make sure that we can get ahead to protect the people in North Dakota. The governor mentioned people, equipment, and facilities in regard to health care. We're working with our healthcare partners now so we can get a daily dump of exactly, I could have said that better, but we can get daily information on ventilators, personal protective equipment, beds, critical care, facilities, and again, with the modeling and where we're getting the test results, we can start making informed decisions with our partners because they have resources they can move around to make sure we get the resources where they're needed to take care of our citizens. I talked before, but it's the right capability at the right time in the right place, and that includes our tribal partners. We had a tabletop with all our tribal partners yesterday because there are unique aspects to this response depending on where you live and the health care that you have access to. We've already reached out to our EMS partners because we don't fully understand what their requirements are. We need to do that so that if we got to move patients around, we can do that smartly and effectively. So this is a whole of state, whole of government approach. And the one thing I'll probably let me one more thing because the governor told me to say this. Again, getting out in front. There are contingency plans like you've heard of in other states, converting dormitories, converting hotels for medical facilities. We have other options we're looking at, but again, we have to coordinate with all our partners to make sure we get that capability in the right place at the right time. But the other thing is we've been contacted by the Corps of Engineers, and they have been given a assignment under the Stafford Act that if a state needs help converting a facility from whatever it currently is to medical care, they are prepared to assist North Dakota in that endeavor. So a lot of resources out there. We will tap into all of them. But again, we got to do our best to get out ahead of this situation. I'll just leave you with this, back to the whole community. What I tell my staff is whatever your specialty is, you got to be thinking every day, what do I bring to the fight? What do I need to be working on? And who else needs to know? And I would say for us to truly get this whole community, and it's not just lashing up with our hospitals and our EMS, but to get a whole of community response, our business leaders, our community partners, they all got to be thinking about what can I do to help the effort. On a personal level, again, follow all those guidelines that we're hitting hard over and over again. But if everyone just thinks, what can I do, whether it's in their own personal life or in their what their vocation is to make a difference. And if we need to be part of that team, please reach out to us and we'll make sure we get you on the team. Thank you.
Thank you, General. And again, in addition to General Dohrmann, State Health Officer Mylan Tufte co-leading our unified command, and also been shoulder to shoulder through this whole thing, Lieutenant Governor Brent Sanford. Thanks again for all the work you're doing, and thanks for being here today. In terms of the wrapping up today, maybe I'll get some of my marks back from the General, but we want to give some shout outs. We know that we've just spent a time talking about physical care and the physical care needed to be ready to deal with the potential surge in COVID-19 cases, specifically COVID-19 hospitalizations. But we also know that during this period of time where we're having economic distress, disruption with our regular patterns on schools and work, it's a time of springtime in North Dakota, which is traditionally sometimes has been a time of stress. We're coming out of that wet fall we had where we had record amounts of crops in the field, which means record amount of revenue risk for the agricultural sector in North Dakota. So we knew that we had farm stress. Now we've got our energy sector that's been set on its heels, and so we know that the level of stress is going up. There's, if we've got a stock indicator that shows that the stock market's going down, there's not an indicator that we can put on the TV that shows the level of stress or anxiety going up, but we know that it is. And so it's important that we work hard at taking care of ourselves, not only physically but also on mental health. And we also know that there are many people in North Dakota that are challenged with and working on or struggling with trying to stay on a path to recovery from addiction. And part of that recovery is developing relationships and connections with others. And during this time of social distancing, it's easy for anybody that's got challenges on the mental health side of their life to feel alone and isolated. So the North Dakota Behavioral Health Division is a key partner as we work through this. They've been seeing an increased volume of calls and requests from support for both individuals and behavioral health providers. And it's natural to feel more anxiety during a time like this, but it's also important that we as adults that we take care of ourselves, even as we're trying to take care of our children and those around us. And we can all play a role in supporting those around us, whether it's using technology, writing someone a handwritten note. The post office is still working, and I've said when you got some downtime here, this is a great time to practice gratitude, remembering those people that have made a difference in your life, because that's good for the giver and good for the receiver. But from a state standpoint, we have a number of things, including some that we launched last fall. So we're going to walk through some hotlines, and we'll put this up on social media as well, and the websites. But we launched last fall at Recovery Reinvented event a hotline called Recovery Talk. And this is where you can call in and talk to a trained peer support specialist in the state who has lived experience with addiction, someone who has understood the recovery journey. And again, those people with lived experience, they've been in the rock bottom situation. They've pulled themselves out. They have training. They can be a listening ear, and that's Recovery Talk. 1-844-44-TALK-2. 1-844-44-TALK-2. Next one. We in our call last night. It was always sad to hear, but not infrequent when we're having a call with the tribal leaders that we hear about an individual who may have completed suicide. And yesterday there was a young person in their 20s that completed suicide on Standing Rock. It's on the South Dakota side of the border, so it won't show up in North Dakota statistics, but it's still part of the Standing Rock Sioux family, and our hearts go out to all friends and relatives. But if this is a chance for each of us during this time, if we identify someone, we're asking people to self-isolate, but isolating can be an indication of depression and or suicidal thoughts. And we've got to, if you're not sure how to talk to people about during these times, you can get help, and you can call the National Suicide Prevention Lifeline and talk to them about, hey, I've got concern about somebody, or you can go on our North Dakota Behavioral Health website, and they'll give you some tips on how to talk to people, because sometimes talking to someone can save a life. And the National Suicide Prevention Lifeline, 1-800-273-TALK, or that's 1-800-273-8255 if you don't have letters on your phone digits like we all used to. But the Lifeline provides 24/7 free and confidential support for people in distress, prevention crisis resources for you and your loved ones, and best practices for professionals. Another thing we've talked about is, again, with this people isolating at home, staying at home, working from home. There's going to be no schools going on. This could be a record amount of family time. Most people are literally during a week will spend more time with their coworkers at work than they do with their family. And so this is a big shift. And in some cases that might be wildly positive, and in other cases it could create new stresses. But we're getting that extra time at a time when the news everywhere is about a global pandemic. There's lots of misinformation floating around, as we've talked about, which even heightens those concerns, and this can leave entire families feeling very anxious, whether it's food security, economic security, health security. But again, we all play an important role in helping our children make sense of what they hear in a way that's honest, that's accurate, and minimizes anxiety or fear. We did launch through the North Dakota Behavioral Health website last year that has a bunch of tips for parents. If you haven't been there and you're home now and you're at, kind of going, hey, I'm running out of ideas on how to deal with this new situation, it's parentslead.org. parentslead.org. Simple tips such as establishing normal routines, recognizing signs of stress, and tips for staying calm. I know that there's a number of things out there, and I know that there are some families that have said, hey, we're in a new normal, and the new normal is going to include the following routines, and kids are being held accountable for the whether it's chores or homework or things that they're supposed to be doing, and some families are taking this as an opportunity to really strengthen their routines and their relationships. Additionally, parents, caregivers, schools, and others can find resources to support age-appropriate conversations, whether you got a toddler, preschool, elementary, middle school, or high school, because depending on the age, you may want to have the conversation differently, but that's all at parentslead.org. And again, great title for the website, because we do need all of our parents to be leaders. Other news as we wrap up here before we go to Q&A, you've heard that federally, the IRS extended yesterday the tax filing and payment deadline from April 15th, our traditional tax day, to July 15th to provide relief. Want to give a shout out to our state tax commissioner, Ryan Rauschenberger, who's followed that lead, and North Dakota will be waiving the income tax penalty and interest, which again gives taxpayers the time from April 15th to July 15th, it's same to do their filing, same as at the federal. This is the right thing to do for taxpayers that are facing financial hardship. For taxpayers who may not be able to meet deadlines for other taxes or other concerns about filings, you can still contact the state tax department. They're still working. You can find guidance on their website, nd.gov/tax. So with that, we are going to conclude our presentations and go to Q&A.
This question might be for either of you gentlemen. Obviously, there's a high demand for doctors and nurses around the country. How do you convince other states or other networks to allow their personnel to come to North Dakota?
That's a great.
Please repeat the question, Curt, if you could.
The question is, there's a shortage of healthcare workers across the country. How do we persuade individuals to come to North Dakota? And that's a question that we deal with all the time. But I'd say even in this situation we're in now, it is more intense. Sanford and CHI Common Spirit have the ability, as being part of a system. We're part of a national system, so that we will do two things. As a system, we will look nationally. Where is the greatest need? Staffing, physicians, nurses, healthcare workers, supplies. And if it gets to the point where we need to make an allocation decision, we will be prepared as a system to do that. We also will be working on our traditional recruitment methods of talking with physicians in other states that may have family, friends here, or retired, other areas, to have them come to North Dakota. Again, should the models increase, should the need arise. Mike?
I think from our standpoint, I think one of the things you have as a system is an internal locums pool. And so instead of going out and using companies that send people from across the country to come on in, you have your own pool of folks that you're drawing from. So I think we would both talk about labor pools that we have set up, and then you have the ability to shift from within the system. And it goes back to now we don't have to worry about licensing, right? So you can move from state to state. So, yeah, thank you.
On that one, on the labor force, I just want to echo what Mike and Curt said. We do want to encourage anybody who's a retired nurse, doctor, any medical field thing to reach out, contact these systems, contact the North Dakota Department of Commerce. We're working to try to establish who's on the bench, who's available as part of that surge pool, because again, Jacob's question, you could end up with the time when we need more people, so does everybody else. And so one of the things we know we could really count on is people that are here, that have been trained, that have had a career, that would be willing to step up, and that identifying a local in-state surge pool is going to be a key part of our planning. Okay, next question. Todd, or behind you?
Renee Jean with the Williston Herald. She's wondering how many patients can the state handle all at once at its current health care capacity? That blue line on the graphic that was imaged, do we know what that number is for North Dakota?
A question from Renee Jean from the Williston Herald. She's asking about the diagram earlier, which is what's the capacity on the blue line. And I'm going to let some of these guys answer, but before they do, I'm going to tell the people that line is a line of healthcare capacity. If you said, what's the line relative to COVID capacity, then there's some of the capacity is fungible. If for example, and you got into a situation where we needed surge capacity and people stopped doing elective surgery, that would free up capacity. If we said, hey, we're going to move people that are non-COVID patients that need a lower level of care, they move to the field hospitals that have been created, and we keep the COVID people that might be in critical or need more care in the critical access facilities or in the hospitals we have. So that's part of the planning process. Is we've got a number today, but that number has got a lot of, I'd say, asterisks next to it because of the way we're trying to deliver elective, emergency, non-elective. We've got extra capacity. Just the way it works, there's capacity in the system right now because in most of our 36 critical access care facilities around the state, what other people might call the rural hospitals, usually 25 beds or less, most of those have got a very low bed count right now. So then again, we got beds in some cases, but we got to make sure that through the planning, we need all three things. We need equipment, we need beds, and we need the equipment, beds, and personnel. We got to have all three of those things to be able to deliver service, and that's what the joint planning is about. But other than knowing that their answer is going to include a bunch of asterisks on it, we might have some gross numbers. If we don't have them, that's part of what the planning. I know that the general's got one of the things he might have walked off with was an actual template that asks all of those questions, because we're trying to actually get down to the actual number of where they are they ready now, would they come out of storage, have they been ordered? I mean, super detailed supply chain planning is what we're trying to do to get to the answer, because it's just a great question. It's a question we're asking. It's never been asked in the state of North Dakota before because we've never had to do not just a system. Each system does that kind of planning, but how do we do that? How do we do that planning for the whole state? That's the next level of collaboration that we need. You guys want to add anything to that?
Boy, you answered that. Yeah. You answered that pretty well. I think as you look at the major health systems, I think we feel comfortable that we're at least at 500, but I think it's the real good question why General Dohrmann's comments are so important that, I love the pickup game, right? We need to get together and have that number. And so as you start to model and go through that, we have an exact number.
Todd, did you have one?
We got a call from a viewer that was watching, and they were just curious if the deadline for food stamps was going to be extended, since there are now people who normally don't get them might be wanting to apply for them.
Question was, is the deadline for food stamps going to be extended? I don't know the answer to that. We did have, I have been in meetings where we've been talking about food stamps, and that's run through, the USDA is the group that does that. There's a bunch of federal legislation which is loosening up regulations and expanding funding. I mean, there's a lot of stuff happening on the nutrition side as it relates to both school nutrition and to the SNAP and the WIC programs. Don't know the specific to that one, but we'll just take that. Tell your viewer that that's one of the action items we'll dig into. Another concern that again has been addressed, which is typically they all come due on one day, and for those people that might have an EBT, electronic benefits transfer, their card that they use, because now you can do SNAP with like a debit card. If they all come due the same day and everybody rushes to the same, shopping for the same items, sometimes in the food stamp program, it actually limits by brand, or it limits by, ounces or weight of a drink or weight of a loaf of bread. And a bunch of those regulations may have made sense at one point in time, but we don't want someone coming into a store and finding out that they're eligible to buy, 16 ounces and the only thing that's left is 20, but they can't buy it. And so again, we're talking to the feds about, trying to deregulate a bunch of those regulations so that we can, get into the business of actually, getting food to people that need it, and not deal with all those regulations. But the specific thing on the date, I don't know, but we've definitely been talking about it. Yes, hello?
Also with the Bismarck Tribune. So today we saw a new category of case come in, possible travel. Can you explain what that is and what the difference is between possible travel and travel is? Maybe that's more of my...
Well, I think the question was, today we labeled one of the cases possible travel instead of travel, and I would refer that back to the Department of Health, and we had yesterday we had Ms. Howell from the Department of Health, who does our contact tracing. She went through that, and so my guess is that we suspect that it may be related to travel, but maybe they're not done with the contact tracing to have actually confirmed that yet. I got a thumbs up on that answer. That was a good one. I didn't, and I think I actually repeated the question, so that was cool. Okay, next question, Dave.
I have one just a little off topic, because there's some pushback from Minnesota legislators on Governor Walz saying we're not being kept in the loop. How are you keeping North Dakota legislators in the loop? And are you thinking about maybe calling them back to this order?
Two questions. One is related to there was. Dave Thompson with a question was Minnesota. There's some pushback on Governor Walz, legislature not being kept in a loop. What are we doing in North Dakota to keep legislature in a loop, and are we thinking about a special session? I'll let Minnesota deal with their politics on that side of the river, but in North Dakota, we're working very closely to stay in touch with our legislative leadership. We've had calls this week with the House and Senate and majority and minority leaders. We had an in-person meeting with some of them, and others called in midweek. Our office is providing regular updates to them. Brent and I are in regular contact with dozens of legislators that are either calling or texting or providing input, and believe me, we appreciate all the feedback there. Our legislators are, they're caring and they're committed and they're connected to their constituents, and we are hearing from a lot of them, and they're feeding information into us that is helpful as we think about all the things that we're doing in terms of emergency orders. But we're going to continue to have standing calls with legislative leadership. We've also made a decision this week to improve it because we knew we could get better than we did in the first week. It was things were moving so fast. We had some lag times we wanted to close up, so then now we've asked for a liaison from Legislative Council to be directly part of the communications team that we're doing so that they can get direct updates as they're coming due. Your second part of your question, Dave, was would we consider a special session? There's some good mechanisms in place for us right now where that's not that's not going to be an immediate requirement. And those mechanisms include the fact that we're operating under the emergency, the emergency that we've got operating right now gives the governor's office the ability to do executive orders which have the force of law. And so this allows us to be very nimble and move forward with legislative input to make decisions we need. Financially, another reason why some states are coming together, I've been on the calls with governors. Other states are already looking at cash flow problems. We are very fortunate that the strong balance sheets that we have in North Dakota, that we do not have some of the, even with our collapse in energy and agriculture, because the legislature worked together with our office and wisely saved the maximum amount possible, $720 million for the budget stabilization fund. We're in that represents 15% of our general fund. So we've got 15% of our general fund covered if we have that kind of a downturn. To access that, we can access that without a special session if we do allotments, and there's a specific legislation about that which we could share that's a little bit complicated. Brent knows it by heart. It's a detailed waterfall, but it basically, if you sum up the whole thing, for us to access the 720, it's great having a former CPA, former CFO as your wingman on all this stuff. It's great. But if we had to do cuts at the state of North Dakota over the remaining, let's call it 16 months of the biennium, say we're 8 months through, if we had to do cuts over the remaining 16, which we may or may not have to, but if we had to, because we were running ahead on revenue through February, which gives us a little bit of cushion because we're revenue ahead. If we cut $288 million out of a $4.8 billion budget, that gives us access to the $720 million in the budget stabilization fund. So between cutting and pulling dollars out of the savings account, we got an opportunity to really provide a substantial cushion, which would be more than 15% of the budget. Now, that's a good starting point. In addition to that, we got the Bank of North Dakota, which has the ability to deliver and decide on loan programs that the bank can do either directly through their own authorities, or they can do it through the support of through the vote of the Industrial Commission. So our state, unlike many others, has got a lot of thoughtful tools that have been put in place that allow government to keep functioning smartly. And I think that's that part of that is because we got a citizen legislature that many of them have run and own businesses or run in their own farms or ranches. They understand what it's like making payroll, and they meet every 2 years, and so they put into place years ago the ability for our state to handle emergencies in between that. So if we get to the point down the road where there, federal legislation or other things that might require the state to do dramatic action, that's always an option. But as of today, right now, there would be challenges because just from a social distancing standpoint, calling the legislature back at a time when we're trying to eliminate large gatherings, we want to protect legislators and their health, not put them all in one room right now. So again, the way we're doing it is, I think, the way we'll keep doing it during the core of this emergency, and then we'll assess that as we go forward.
If I can follow up on that then, Governor, how long can our cushion last?
Well, we're not even touching it now, as we say, because we've got we're running ahead. I mean, we were running ahead on tax revenues. I think, Brent, was it how much more than couple $100 million ahead through the end of February, and so. And again, even if you go back to the oil crisis, crunch that happened, the last time there was, I think the last time there was a special session was probably August of 2016, and I think the legislature at that time was making reductions in the budget of about 6% that happened, and we've got a cushion of 15%, built up. So I feel like we can easily run through this biennium between the budget stabilization fund and the other and the revenue that we have going ahead, and the ability to cut back, because there may be during this period of time, I'm guessing that the travel budgets across the state of North Dakota are going to be less. I'm guessing that, some of our, universities might be spending less money. I mean, when you actually total up the budget, this lack of activity, there may be some actual savings that are showing up in terms of how we're delivering government today versus how we were before.
Eric Art from KZZY in Devils Lake. Given the news out of Italy today and the fact that community spread is here in North Dakota, what is your trigger for enacting any more shutdowns or closings of businesses for temporary measures to slow spread over the virus?
Question from Devils Lake was based on the news coming out of Italy and what are the triggers in North Dakota for enacting additional steps to either more business closures or more steps to try to enact more social distancing. Where we are today, as you saw, we did an executive order related to pharmacy, but we every day are evaluating, do we need to be more restrictive in terms of the mandatory aspect? We made a decision again to come forward today with no more mandatory closures than what we had set up, Thursday and yesterday. We continue to monitor that on a daily basis. If you're asking what the triggers are, it's sort of twofold. One is the data and the case data. We know it's lagging, but it's still positive that at least for now that we've had a day where it's gone down, not up, 2 days in a row. And then the second thing is that we're monitoring is how well is individual responsibility working? And if we can, dial up the individual responsibility, whether, if people have been exposed to somebody that they think is sick, if they then go, I need to stay away from people even though I'm not feeling poorly, or if you've got any symptoms of being sick, then you isolate. If people are doing that and then everybody else that's healthy is staying 6 feet away from each other and trying to figure out a way to go about their lives, then we might have to do anything. We might flatten the curve the way we are now. But if we see social distancing not happening, if we see cases going up, then we might have to become more restrictive. We think if North Dakotans act with a lot of social individual responsibility and caring about their neighbors, maybe we will not end up where New York or California is. But I think every state in the nation, every governor we've talked to at some point has to have among their options shelter-in-place options if it starts to spread, because you might have to have more forceful approaches to stopping it. But we'll, again, counting on the people of North Dakota, individual responsibility, and what we've already put in place. We've eliminated lots and lots and lots and lots of contacts between people with the decision we've already made. The big ones that are remaining, other states have made decisions around what I call personal services, and that might include nail salons, cosmetologists, beauty salons, barbers, massage therapists, people that are, through personal service required that contact. Most of these in North Dakota are sole proprietorships or small businesses, and many of them are making their own decisions. And again, we respect small businesses and their own decisions. If they're concerned about their own health or the health of their employees, they can voluntarily shut down as part of their own social distancing strategy, or they can, only, by appointment, no public walking in, do their own kind of screening. There's lots of things that people can choose to do. That's the great thing about being an entrepreneur, is you get to make up your time and your rules and how you do that. But right now we haven't felt, because we've seen a lot of creativity and activity among those small businesses in our state, we didn't feel that the state of North Dakota needed to do anything mandatory at this point.
How many unemployment claims came in on Friday?
Question from Bismarck Tribune was how many unemployment claims came in on Friday. I know we'd announced yesterday that we had 400 last week in the whole week. We had 600 on Wednesday. We had 1,600 on Thursday, and I haven't heard the number today. Has anybody got a number for today? If not, we'll get it for you, because that gets tallied every night, and that's why we didn't have it yesterday at 4 o'clock, but I'm sure we've got a number that got spit out. We'll get that to you. And again, through yesterday, again, because of the work, the 600 on Wednesday and the 1,600 on Thursday that came in were almost all directly related to the energy slowdown in North Dakota, specifically oil and gas. And we will expect to see in the coming weeks, that's when we'll expect to start seeing claims coming in from retail, hospitality, bars, restaurants, et cetera. I did talk to Senator Hoeven today, and it was in contact with the rest of our CODEL as well. Lieutenant Governor Sanford's also been very strong on that, but one of the ways that we think would be very smart for the federal government to channel dollars to states would be through strong support of the unemployment insurance program, because there's already systems set up on how to get checks to people. There are already mechanisms in place on how to do that, and we know that we've got backstops that we can do behind our unemployment fund today, as I described yesterday, with borrowing. But we would that would be a fantastic way for the federal government to support the people who are unemployed. Okay, we got the numbers just in from the back row, phone to friend there. Thank you. Jody Hansen, that was 2,600 yesterday. So 600 Wednesday, 1,600 Thursday, 2,600 yesterday. I'm going to take a guess that that's the highest, most rapid increase in unemployment gains or claims, unemployment claims in the history of North Dakota in a 3-day period. I'm just going to take that as a wild stab. Will back me up. We'll see if intuition comes through. You're not supposed to be up to the podium and just be like making guesses, but I'm thinking that's the record. Okay, we're getting at the end here, I think. Okay, listen, again, we'll close out the key messages from today. You heard it from our healthcare leaders. We're working with the state of North Dakota and the healthcare community to make sure that we've got even more detailed planning, more collaborative planning than we've done before. But again, thank you to the leaders. Thank you to everybody that works in your organization, and especially, as we heard right from the beginning from the chaplain, let's be thinking about those frontline healthcare workers, whether they're in long-term care, whether they're in the emergency room, whether they're in a clinic, or whether they're taking care of people in an ICU. Let's be thinking about those people on the front line. They literally are our heroes in North Dakota. They are saving lives, and we can help them save lives and help keep them out of risk by practicing all the things that we want to do on social distancing that we're talking about, and washing your hands and staying home if you're sick, and staying away from people even if you're young and healthy. It's a good idea to do that because you may be carrying it and you don't know that. That's what the data would show. With that, again, thanks to the media for helping us get accurate information out there. We're about facts, not fear. We're about North Dakota smart versus North Dakota tough. So again, thank you all, and we'll see you tomorrow at 4 p.m.